Hello and welcome to Time of Death. I'm Ris.
And I'm Dee.
And if you're new here, welcome. We are two nurses that like talking true crime. We like to focus on cases that have a heavy medical influence to them or cases that feature a medical professional as the perpetrator or victim. For this case today, it's not true crime related, but it is definitely nursing related. And this tragic event really affects the nursing community, and of course, more than that, her family. Today, we're going to be talking about Hailey Okula.
And I just want to go on the record that, yes, this falls under the scope of our podcast because in our disclaimer, we do say where healthcare and true crime intersect. So I've gone rogue with the medical mysteries. Ris is going a little rogue tonight, but it still all applies. So just a disclaimer for any haters out there.
And, I think it's fine because we're still doing informative educational case and something that really is, like I said, affecting nursing as a whole.
And we make the rules.
And we make the rules.
And Bubba makes the rules. Yeah. Or we're going to have our bodyguard, Bubby, attack Cat while he's paying you a visit. Look at him. He looks vicious tonight.
So cute.
You're so cute.
He's like a mythical unicorn. When you're first starting out in nursing, and even throughout your entire career, it is so helpful to hear from other experienced nurses about nursing topics, navigating a new career, and understanding very complex topics that you can find, in nursing. One nurse in particular, Hailey Okula, was excellent at sharing her experiences and educating nurses, especially new graduate nurses. Hailey was a 33-year-old ER nurse known online as Nurse Hailey, and she shared a lot. She was a nurse educator online, and she shared reels and informative videos about certain nursing topics that grew very popular. She grew up in a family of nurses. Her mom was a nurse, and this helped her make the decision to become a nurse and follow in the same footsteps as her mom. But she did not initially want to be a nurse. She was a gymnast for 18 years, and she was a gymnastics champion, D1 gymnast at Boise University. She went on to graduate with her bachelor's degree in digital media, and after that, she decided, I'm going to switch to nursing. So she got her ADN, or associate's degree in nursing, in 2019. And then she started working in California as an RN on a med-surg tele floor in 2020. She got her bachelor's in the summer of 2020 and then pursued her goal of working in the ED, where she started in January 2022. So after she graduated from nursing school in 2019, she went on to create a business for new nurses called RN New Grads. And RN New Grads provided a lot of educational content, cheat sheets, flashcards, interview advice, a lot of important tidbits that a lot of people found extremely helpful. She gained a lot of popularity for breaking down these complex, hard to understand topics. And she was very well loved. She had almost 500,000 followers on Instagram. On this page, she also shared her struggles with infertility with her husband, Matthew Okula, who was a firefighter in LA. They finally got the good news after trying for 2 years and posted online on September 17th, 2024, that she was pregnant. And she went on to share updates as the pregnancy progressed. Tragically, she died last weekend on March 29th after rare complications during childbirth. She just gave birth to her son, Crew, and was able to see him and laugh briefly with Matthew about Crew's personality before she suddenly coded. Staff began CPR quickly. The husband, was told that this happened, and he was, of course, like, what do I do? Like, do I go with my son? Do I stay with my wife?
Possible.
Do I follow her to the ICU? Like, trying to make this impossible decision and having, like, this life-shattering news that you weren't expecting. Like, she had a healthy pregnancy as far as I could see. So she died from an amniotic fluid embolism. This is a really, really uncommon complication of pregnancy, and it can happen so fast, and there can be like no indication anything's wrong, and then suddenly it's like, whew. It is the second leading cause of maternal postpartum death. Her husband shared online, "Words cannot convey the depth of the loss that I feel. Hailey was more than I could have ever dreamed of in a wife and partner. She was gorgeous, smart, hardworking, passionate, and above all else, unbelievably loyal." He also wrote how badly he and Hailey wanted to be the parents to their new little boy. As for RN new grads, Matthew is working through the logistics of continuing her hard work once things settle down. So what is a amniotic fluid embolism? First of all, it's very scary because, like I said, it can just happen out of the blue. And basically, the way that it's thought to work, and it's of course not really well understood either, but the way that it's thought to work is that there is like an interruption in the barrier between the mom's blood and the amniotic fluid. And this leads to amniotic fluid entering mom's bloodstream and then moving into the lungs. So basically, like, that amniotic fluid or cells from the fetus, hair, or other debris goes into mom's circulation, and it ends up in pulmonary circulation, and it causes a blockage and an anaphylactic type reaction, and it results in the activation of the complement system and just really causes a lot of horrible symptoms.
Fun fact, Ris and I went to the same nursing school, just many years apart. Centuries ago, when I was in nursing school, along with Florence Nightingale. You're not laughing.
You were a colleague of Florence's?
I know Flo.
I know Flo.
Me and Flo go way back. Flo was a pioneer. But anyways, I'm jumping all over the place. Our shared nursing instructor, she had someone, a friend, I think it was a colleague, that had this amniotic embolism and died. And
can you survive that?
Mm-hmm.
I think it is possible, but they have to recognize what it is. But this person unfortunately passed too. But it's super scary. It's there. I don't know what the risk factors are. I don't really know a lot about it, but it just is a testament that childbirth is a very scary thing even now in this time. It's still a very dangerous undertaking. I remember learning about it and I was like, wow, never me. I will not. I will only have fur babies.
Amniotic fluid embolism was first discovered basically in 1926. It's super rare. It only occurs like 1 in 8,000 or even 80,000 deliveries. These numbers, however, should be taken with a grain of salt because it is so hard to diagnose. And if it's not fatal, it can be underreported. It can either cause a relatively mild organ dysfunction to the other end of the spectrum, where it can be very severe and lead to coagulopathy, cardiovascular collapse, and ultimately death. We don't really know why this happens. It can happen in healthy pregnancies, during labor or during a C-section, or when it's a difficult vaginal birth, or it can occur during a mom's second trimester of pregnancy, or it can happen up to 2 days after delivery. So it can happen during pregnancy, during labor, or after postpartum. It can also be prompted by trauma to the abdomen during an abortion or during amnio infusion, which is basically putting like sterile fluid into the amniotic sac during pregnancy for various reasons. Other risk factors include having had other kids previously, intense contractions while in labor, being induced, history of placenta previa, eclampsia, having multiple gestations like twins or triplets, having uterine tears or tears in the cervix, if the placenta separates from the uterus wall or placental abruption. All this stuff can increase your risk factor. And it seems like these are like things that just like having a C-section, being induced, like this is stuff that happens all the time. In Hailey's case, she was having a C-section. I also saw like having a male baby can increase your likelihood, which is crazy. It's just crazy. Like apparently this just like randomly can happen and there can be no indication, it's just really scary to think of. So once the amniotic fluid, hair, fetal cells, whatever it is, that will trigger an inflammatory response, which will lead to massive vasospasm, pulmonary hypertension, and a formation of a clot. And all this stuff results in the symptoms that one has with a amniotic fluid embolism. These symptoms can, of course, like I said, happen suddenly, and they can be very dramatic. And usually these patients can appear perfectly fine until the moment of collapse. And the classic signs include like sudden respiratory distress, hypotension or really low blood pressure, and they can also have seizures. But, these symptoms can vary, and they can complain of, I'm having some shortness of breath. They can say they're having chest pain. They can also say they're having a sense of impending doom, which we know is a red flag for something bad to happen. This is followed by cardiovascular collapse, often with a big drop in blood pressure. And if this goes untreated, DIC and multi-organ failure can follow shortly after. Usually these patients end up intubated and on a ventilator due to such profound respiratory effects. So diagnosis is clinical basically, but it's also a diagnosis of exclusion. And typically it's when someone has such a sudden onset, sudden collapse during labor or right after labor, 2 days after labor, a lot of people have like an alarm bell for amniotic fluid embolism.
One more thing to be anxious about. Man.
I know. There's no like single like blood test or imaging that definitively diagnoses amniotic fluid embolism, but some labs like an elevated D-dimer, you could have abnormal like coag studies, and patients becoming hypoxic can also help with this diagnosis. Ultimately, these cases, however, are only confirmed post-mortem or through the resolution of symptoms from treatment.
Also smells. It also sounds like a PE.
Yeah, it does. Well, it's basically a clot in the lungs, but it's more like an anaphylactic. From what I've read, I don't work maternity, so correct me if I'm wrong here. But from what I've researched, it's like a clot in the lungs that triggers an inflammatory response and a kind of like anaphylactic reaction. So
pop a Benadryl before you go in.
Take a little aspirin.
It's not a medical advice. It's just stupid. Pop a Benny before you give birth.
Oh God, this is not medical advice. This is not intended to be medical advice. This is just us and our dumb opinions. So typically these patients are treated for their symptoms, of course. For example, medications to help treat the hypotension, such as Levophed, or a vasopressor, or vasodilators for pulmonary hypertension, and antifibrinolytic agents is the primary approach. However, research is ongoing. They're thinking maybe like steroids or anticoagulants may be useful. I think with DIC, you treat it with heparin.
Mm-hmm. Because yes, person is bleeding, but there are also clots.
It's like a bleeding clotting disorder is what DIC is. DIC always confused me, but I do know that typically they use heparin, which is a blood thinner, which we use to treat that. Steroids or anticoagulants aren't typically used in these patients. They're often giving fluids or blood products to help correct what's going on. Some women will recover fully after amniotic fluid embolism, but a lot of patients can have long-term complications such as neurological deficits or cardiac issues, especially if there was significant organ failure. When you think about it, if you're not getting enough oxygen, you don't have enough oxygen going to your brain or important organs, so that can cause damage if it's not reversed quickly. The maternal mortality rates range from 20% to 60%. So basically, acting very quickly is critical in these patients. In addition to causing these effects in mothers, they also can cause a lot of distress in the fetus. It can cause this distress due to the hypoxia and also the cardiovascular collapse. This can lead to abnormalities in the fetus's heart rate. It can also potentially cause loss of the fetus. It can result in premature delivery, which exposes the baby to risks like respiratory distress and their organs not being fully mature. Placental insufficiency can also occur, leading to intrauterine growth restriction or even a placental abruption. The fetus can also suffer neurological damage from this prolonged hypoxic state. So the same thing as you would in a mother, you're going to have to work very quickly in the baby as well. So a quick delivery and then resuscitating the baby ASAP are critical for preserving the life of the baby.
Ris, I just want to thank you. I think it's also important to recognize that this is something that can, is possible, something that I'm sure is not very frequently talked about. So I love how you presented the information in a very factual manner and did let people know about, this, as well as giving a lot of people closure, because this was someone who was, a mentor to a lot of RNs, especially younger RNs in our community. So we definitely want to recognize Hailey for, her contributions, her support. She sounds like an incredibly savvy young person. And we really extend our condolences to her husband and her baby, as well as her extended family, for their unimaginable loss. A lot of times nurses are the default family member who have to navigate these really complex medical situations. So I'm glad that she came from a family of nurses that I'm sure were very supportive to Hailey's husband. But, I think that recognizing, this, it's really complicated to navigate the medical system, especially for a loved one or for yourself, and having those advocates is so important. So I really hope that, he had, and the baby even had those supports in place to help him navigate this really, really hard situation.
I know that there is a GoFundMe that was organized for Matthew Okula and the baby. So I'll add that in the sources for this episode if you want to donate and help during this tragic loss for Matthew and baby crew, and just to help lessen the financial impact on them at this time. Absolutely. And I just want to add that Hailey was, I know I've seen her videos before, and especially when I was, earlier in my career, when I was trying to understand these things that just made no sense to me. And seeing some of the videos that she posted, I know she posted some like about electrolyte abnormalities, just like understanding things. And the way she broke it down in the videos, it was like, okay, we need to do this, we need to do this, we need to do this. And I really feel like providing that structure for new nurses was so beneficial, and she really was great at it. And she also seemed like such an open and accessible person. Like she seemed very relatable, that she was open to any questions anyone had, that she was actually very willing to help and go above and beyond to be a mentor and supporter for new nurses and any nurse. She was a beautiful person. I'm so sorry that she can't be physically present for her baby's life. It's a very tragic loss, and I'm so sorry for her family as well.
So this is the second most prominent cause
Yeah.
of death.
But it's kind of rare.
So isn't it interesting that it's so rare, but the second leading cause? So it's actually a good thing that it's, you know,
Yeah.
that, you know, it is a very rare complication,
But it's the second lead.
but that means that death is less common.
I know we were a couple days late with this episode, but I promise next week we'll be back on track finally.
Because it's me.
Excuse me?
Because it's me.
Yeah, Dee's got it, so no one has to worry anymore.
Yes.
But thank you all for listening. And again, if you want to donate to Hailey's GoFundMe, I will link it below. And we'll see you here next week. Thank you so much for listening and continuing to listen to us, even when we're a little bit all over the place.
Bye, guys. Thank you.
And the time of death is 21:47. That is 9:47 for those of you who do not use military time. And we are checking out.
Bye.
Bye.